Took a pregnancy test and it's a faint positive line. That's a positive, right? What does it mean? Stay tuned and follow along. Chorionic gonadotropin hormone, or HCG, is the level that is detected in your urine. This is the hormone that is produced by the placenta once you become pregnant. The hormone is detected once the embryo is formed. This is the fertilization of the egg by the sperm. HCG is present in maternal circulation about 8 to 10 days after ovulation in women who have a normal 28-day cycle. The normal range for HCG concentrations varies quite significantly across pregnancies, so we don't generally use this to determine how far along you are or your gestational age. However, HCG levels are very sensitive in the first 1 to 3 weeks of pregnancy. Therefore, when an HCG level is detected and is rising normally, this is likely indicative of a normal pregnancy in the uterus. Line on a home pregnancy test detects the pregnancy hormone in your urine. However, there's a few things to take into consideration, especially if the line is faint. First, make sure that the control line on your pregnancy test also shows up. This shows that your pregnancy test is actually accurate since it's showing the control line. The best thing to do is to repeat the pregnancy test within about a week. The other thing you could do is contact your doctor. Your doctor may be able to order a blood or serum pregnancy level that may be more sensitive to determine where in your pregnancy you may be. HCG levels, or the concentration of the hormone detected in the blood, double every 30 to 50 hours, so that's about every 1 to 2 days in a normal intrauterine pregnancy. However, if the HCG levels rise slower, this can be indicative of an abnormal pregnancy or an ectopic pregnancy. Of HCG in a woman's blood peak at approximately 8 to 10 weeks of pregnancy. The range is quite large between women. The numbers can be anywhere from 5,000 to 150,000. Therefore, it's really difficult to use HCG to determine how far along you are in your pregnancy. After 8 to 10 weeks, the HCG level starts to decrease and levels out at about 20 weeks of pregnancy. Blood tests are more sensitive at detecting HCG levels in a pregnant woman before she has missed her period. However, this is not usually common. The more common type is using a urine pregnancy test at home. The levels needed to detect a pregnancy in the urine are 10 times higher than a blood level. Therefore, it is recommended that you don't check a pregnancy test until about 1 to 2 weeks after you've missed your period in order for it to be most accurate. Urine pregnancy tests can also cause a false positive. This can occur if the HCG levels begin to rise and then the pregnancy fails after implantation. This can also occur if there is an HCG related tumor in the woman. And lastly, it can occur very, very rarely in familial genetic syndromes. However, there are risks of false negatives. False negatives can happen if a pregnancy test is taken too early before a missed period or too close after a missed period. If you do get a false negative or a faint line, the recommendation is to repeat the test within 1 week to see if the line is stronger or present at all. Again, follow along on FemHealth on the YouTube channel and on Instagram for more information on women's health.